So, the topic for this class is radiographs in forensic odontology, wherein we will be dealing with the various radiological methods that are used in the field of forensic odontology for the victim identification or the identification of the suspect. Teeth play an important role in forensic dentistry. Dentistry for dead individual identification as well as for alive persons to clarify criminal and civil liability issues. Teeth maturation provides a valuable index of the dental age and serves as a better index of the maturation than any other indices. Various factors associated with teeth such as tooth eruption, calcification, attrition, secondary dentin deposition, periodontal diseases, root translucency, cementum apposition, root resorption, color changes, increase in root roughness, any other kind of all these dental changes related to age which are analyzed as different dental age estimation methods. When we specifically speak about radiographic methods, they play a very important role in the forensic odontology. Radiological images are utilized in the process of age estimation, which is one of the essential tools in identification in the field of forensic science. Various radiographic images are used such as intraoral periapical radiographs, lateral oblique radiographs, cephalometric radiographs, panoramic radiographs, digital imaging or even advanced imaging technologies. The first case which was recorded was of the Adolf Hitler, one of the most published cases, wherein the detailed dental records including radiographs and denture and natural teeth were used for identification of the body of Adolf Hitler, especially by the identification of the 9-unit bridge which was present in his maxillary and mandibular teeth. Comparative dental identification is also very important, wherein the comparisons of antemortem and postmortem radiographs are done. These radiographs are assessed for various factors such as number of teeth which are present, how is the arrangement of the teeth in the jaw, any kind of caries or periodontal bone loss which are present, any restorations, any hidden fillings, dental anatomy, trabecular bone pattern, anatomic bony landmarks, maxillary sinus, frontal sinus, any other bony pathologies which are present, and these are compared between the antemortem and the postmortem radiographs. Apart from the teeth, there are various other features that can be considered such as the paranasal sinuses or the skull features. Especially when we consider the paranasal sinuses, the maxillary sinus and the frontal sinus are known for their greatest normal variations among individuals, and hence it can be used in the identification by superimposing them on the antemortem radiographs. Now this is a case of a 16-year-old female who was reported missing for over a year, and her body was encased in a waterbed frame. So she was a victim of homicide. She became mummified in the dry, cool conditions under the bed. So when we see this image, despite the severe destruction of the soft tissues, however the teeth remained in perfect condition, and hence these were used for the antemortem and the postmortem radiographs were compared for the victim identification. When we specifically see here, this was a totally non-restorative case, first factor, and the second factor was the presence of a mesodense. Because of these two important evidences, the victim was positively identified. When it comes to medico-legal cases, evaluating intentional traumatic injuries of the skull sustained by the victims by analyzing the point or even the direction of impact plays a very important role. By assessing this, we can also assess or get a fair idea about the shape of the object or the weapon that was used for the crime. When we speak about gender determination, assessing the gender of an unknown human skeletal remains is the second step in the reconstructive dental identification, and it helps in building the dental profile. So radiographs can hugely contribute to gender determination. Both morphological and metric methods are used. There is this Krogman's cranioscopy for gender determination, which is based on the characteristics of the skull. Various characteristic features of the skull are used for gender determination, such as the frontal and the parietal eminence, supraorbital ridges, the orbits, the zygomatic arch, occipital eminence, glenoid fossa, forehead, glabella, foramen magnum, palate, etc. When we specifically speak about the forehead, now when you see between the male and the female, the males are having forehead which is slightly sloping, but when it comes to females it is almost vertical. So, this is one of the skull features, that is the forehead sloping, can be used for gender determination. When you speak about the another important skull feature, that is the glabella. Here when you see the images, here you can see that in the males the glabella is moderate to heavily curved, but when it comes to females it is almost flat or it is very slightly curved. So, this also can be used as a very important feature for determination of between males and females. Apart from all these two-dimensional, the three-dimensional such as CBCT also is used for gender determination. Here is an example wherein the volume of the frontal sinus was measured using CBCT, and this was used for the gender determination. Evaluation of radiographs to assess tooth calcification is a much better alternative because calcification can be observed from radiographs for a period of several years. It is not altered by any local factors, and the study of tooth calcification also lets us assess age at periods when no emergence takes place, that is between the age group of 2.5 to 6 years and more than 12 years of age. The advantages are it is simple and easy to master. Age estimation also gives us accurate analysis, and dental calcification gives us a better indicator of age in the first 2 decades of life. Age estimation using the dentition may be broadly grouped into 3 phases, that is age in the prenatal, neonatal and early postnatal, age estimation in children and adolescents, and age estimation in adults. When we speak about prenatal, neonatal and postnatal age estimation, radiographically the mineralization of the deciduous incisors starts at the 12th to 16th week of intrauterine life. Before the mineralization of the tooth germ starts, the tooth germs may be visible as radiolucent areas on a radiograph. The subsequent radiographs of the mandible will depict the deciduous teeth in various stages of mineralization as per the prenatal age of the fetus. So, here we have the image of radiograph showing upper and lower jaws with developing dentition of children aged in the figure A 2 years and 6 months of age, figure B 3 years and 9 months of age, and figure C 6 years and 8 months of age. The radiographic analysis of developing dentition, especially when there is no clinical evidence available, it acts as a clinical tooth emergence in various phases, will help in the age determination. We have stages by Cross and Jordan given in the year 1965. They studied the early mineralization in various deciduous teeth as well as the permanent first molars. The development is described in 10 stages denoted by the Roman numerals from 1 to 10. The 9th stage includes 3 stages and the 10th stage includes 5 stages. So, these figure you can see developmental stages of the lower deciduous first molar by Cross and Jordan. The development is described in 10 stages. The 9th stage includes 3 and the 10th stage includes the 5 stages. Age estimation in child and adolescents. Schauer and Massler method in the year 1941. They study the development of deciduous and permanent teeth, describing 21 chronological steps from 4 months to 21 years of age, and published the numerical development charts for them. This is the numerical development charts. This is given for deciduous dentition, mixed dentition as well as the permanent dentition. These are the subsequent radiographs for the same. Moving on to Nolla's method, which was given in the year 1960. Nolla evaluated the mineralization of permanent dentition in 10 stages. After every tooth is assigned a reading, a total is made of the maxillary and the mandibular teeth, and then this total is compared to the table which is given by Nolla. The Nolla's developmental stages are given below. Here you have stage 0 where there is absence of crown, stage 1 presence of crypt, stage 2 where there is evidence of initial calcification, stage 3 wherein the 1/3 of the crown formation is completed, stage 4 2/3 of the crown formation is completed, stage 5 crown almost completed, stage 6 crown completed, stage 7 1/3 of the root formation is completed, stage 8 2/3 of the root formation completed, stage 9 wherein the root is almost complete but the apex is open, and stage 10 apical end of the root formation is completed. The advantages of this method are that it can be applied to an individual with or without the molar, and that girls and boys are dealt with separately. Moving on to Demergence method. Stages are defined by changes in form and development of the teeth, and these stages are independent of the possibly complicated length measurements. The advantages of this method are, it includes the objective criteria describing the stages of tooth development rather than tooth eruption, which have been illustrated with line diagrams and radiographic images in a very clear-cut manner. The development of 7 mandibular teeth on the left side was divided into 8 stages each, and these stages were named from A to H. So, here stage 0, wherein there is no evidence of calcification. Stage A, the cusp tips are calcified but have not yet fused. Stage B, the calcified cusps are united, so an outlined occlusal surface is well defined. Stage C, enamel formation is complete at the occlusal surface, dentinal deposition has commenced, the outlines of the pulp chamber are curved. Stage D, crown formation is complete to the cemento-enamel junction, the pulp chamber in the uniradicular teeth is curved, being concave toward the cervical region. In the molars, the pulp chamber has a trapezoid form. The pulp horns are beginning to differentiate, root formation is seen. Stage E, the walls of the pulp chamber are straight and the pulp horns are more differentiated. Stage F, the walls of the pulp chamber now form an isosceles triangle and the apex ends in a funnel shape. Stage G, the walls of the root canal are now parallel and its apical end is still partially open, especially in the distal root in case of molars. Stage H, the apical end of the root canal is completely closed. The periodontal membrane has uniform width around the root and the apex. These are the schematic representations of the various radiographic stages of H, G and F. Figure 1. Figure 2 depicts stage E, D and C. These are the separate score tables based on the development stage for boys and girls, which is given by Demergence separately. Age estimation using open apices is another method, wherein in 2006, Kammerer et al. Presented a method for assessing the chronological age in children based on the relationship between age and measurement of the open apices in teeth, which gave reliable estimates of the ages of 455 Italian Caucasian children. In this method, the 7 left permanent mandibular teeth were valued. The dental maturity was evaluated using the normalized measurements of the 7 left permanent mandibular teeth, the sum of the normalized open apices depicted as S and the number denoted as N0 of the teeth with root development complete. Age estimation in old. Clinically, the development of permanent dentition completes with the eruption of the third molar at the age of 17 to 21 years, after which the radiographic age estimation methods becomes difficult. In this, we have 2 important methods. One is by assessing the volume of the teeth, and secondly by assessing the development of the third molars. In assessing the volume of the teeth, we have pulp to tooth ratio method given by Quall and coronal pulp cavity index. Whereas in development of third molars, 2 methods are used, that is Harris and Notche method and Van Heaton system, and also Olsey's method. So, third molars in the age estimation, it is a valuable indicator of age in the age group of 16 to 23 years. When all the 4 third molars have completely calcified, the chances of the individual being 18 years old is 96.3% and 95.1% for males and females respectively. When only 1 or 2/3 molars present, then the lower third molars act as the best predictors of whether an individual is 18 years old. So, this is the Harris and Notche method, wherein we have 5 stages. Stage 1, wherein cleft rapidly enlarging, 1/3 of the root is formed. Stage 2, half of the root is formed. Stage 3, 2/3 of the root is formed. Stage 4, we can see diverging root canal walls, and stage 5, converging root canal walls. Van Heaton system, they assessed the development of the mesial root of the third molar to determine the age. He described the development of the mesial root in 5 stages using panoramic radiographs. The males and the females were surveyed separately and no significant differences were found between them. Now, here the table shows the stages of the mesial root development of the third molar by using Van Heerden method. Stage 1, crown complete, and there is radiographic evidence of root formation. Stage 2, when the root length is more than 1/3 but less than 1/2. Stage 3, the root length is more than 2/3 but however it is still not complete. Stage 4, root fully formed but it has an open apex. Stage 5, apex is closed. And then we also have the Alzey's method, wherein it is divided into 4 stages A, B, C and D. Stage A, occlusal plane is covered with the alveolar bone. Stage B, alveolar emergence, complete resorption of alveolar bone over the occlusal plane. Stage C, gingival emergence is there, penetration of the gingiva by at least one of the dental cusps of the molar. Stage D, complete emergence of the tooth in the occlusal plane. So these are the various radiographic methods that are used in forensic odontology. So to conclude, forensic odontology plays a very important role in the victim or the suspect identification, and radiographic methods act as a very important adjunctive valuable tool for determining the same. Thank you.